Welcome back. Despite filler and Botox, facelifts are still widely popular even today. At 53, our next guest, Carol Ann, was unhappy with her appearance, so she turned to her boss to turn back the clock.
I'm Carol Ann. I am one of the registered nurses here at Carmel Valley Facial Plastic Surgery. And next week, I am having a full facial rejuvenation with Dr. Karam. I'm really excited. Full facial rejuvenation is vertical restore, which is face, neck, and brow. I'm having my upper eyes and lower eyes, and also fat transfer and a contour laser. I'm 53 years old, and when I look in the mirror, I see a lot of laxity in my neck and my jawline. I feel like my eyes look tired, and I just want to look as good on the outside as I feel on the inside.
Carol Ann and board-certified facial plastic surgeon Dr. Amir Karam join me. Hey guys, welcome to the show. It's been a few months since the procedure, so let's start right off by seeing the before and after. Wow. Who is that person? That is really nice. I got to say, that is very, very nice. So, Carol Ann, how was the healing process, and what exactly do you, I know what I like about it. What do you like about it?
I was back to work at 2 weeks, and now I'm 3 months out, and I think it took at least 10 to 15 years off my face, and now I look as young as I feel, and I feel great.
Dr. Karam, how is this facelift different than what the typical approach is?
The vertical restore technique that I developed is basically an extension of the traditional facelift, but a real difference in some important ways. Number one is the traditional facelift lifts the face or pulls the face sideways. There's this sort of horizontal vector that's involved in it. And that makes the face look flattened, and it makes it look pulled, and that whole windswept look that everyone talks about. And that's not what people do when they go in front of the mirror. I think most of the audience who are in that aging phase can relate to this. When they go in there, they're lifting their face kind of more in this vertical direction. And when they do that, they see themselves come through. There's three different components of the face that are aging simultaneously. Number one is the shape that we talked about, which is this sort of elongation of the face over time. And then there's the loss of volume, right? There's the fat pads that are underneath the skin that start to lose volume as time goes on. So that's a deflation effect that happens. And then the third area is the wear and tear on the skin from sun damage, genetics, lifestyle, etc. So for me, the way to really turn back the clock and make it look very natural and truly make somebody look like they did in a certain decade is to address all three of these areas together. So in her case, we did a very traditional, multi-level or a comprehensive approach where we restored the shape of the face with the vertical restore. We treated the eyes with blepharoplasties, and then we enhanced the volume with the fat transfer, and then finally took care of the skin with the laser resurfacing. So when you treat everything together, that's effectively like what you do when you're trying to restore a home. Instead of treating just parts of the kitchen, for example, the countertops and the flooring, here we're treating the entire kitchen so that when you walk in, it just looks like this is how it's supposed to look, as opposed to bits of old and bits of new all put together. And that also is another reason why people look natural.
And Dr. Karam, people are doing a lot of these non-invasive anti-aging procedures. What do you feel about those? Are they effective for a certain demographic?
There's a period of time, let's call it late 30s, early 40s, where the primary change that's happening in the face is volume loss. So in those cases, fillers done in a very subtle and very light-handed way can be very effective. They can restore that little bit that's been lost and things look nice. But once you get to a point where the fascia is sort of sagging and drifting downward, that's a common mistake that I think a lot of people make, is they assume that they can fill that problem away by putting in a lot of filler in the cheeks or putting a lot of filler along the jawline. And what ends up happening is people start to look different than they ever have because of this excessive volume. And that in of itself is a natural and strange look. My recommendation is, instead of wasting their time and money on these things that are going to usually disappoint them, all these ultrasotherapy, ultrasound, and all these different types of radio frequency devices, instead just wait until you are ready and do the thing that's actually going to give you the result you're looking for.
And I know that prices vary, so I know you go to different surgeons, different things are done, but what's the general range for a facelift like this?
It depends on the specific procedures that we're putting all together, because there's scenarios where somebody just needs a fat transfer, and that's something that ranges in the $10,000 to $12,000 range. Somebody who needs just the lift by itself, that's somewhere in the 20s, and then when you put it all together, it can get up to $50,000 in some cases. And there's a range, as you said, between different surgeons, but it all depends on the combination of the procedures that are being done together.
Well, Dr. Karam, thank you so much. Carol Ann, you look great. You look 10 years younger. Go out and be 10 years younger.
Thank you.
All right. And I'll have